This is the first in a series of videos where we will address the topic of dementia and the symptoms that characterize it. And what strategies can we use to manage them? What is dementia? Well, dementia is a syndrome characterized by a progressive deterioration of cognitive and behavioral functions, which leads to the emergence of different symptoms related to memory, language, behavior, and orientation in space and time. To be more accurate, we should talk about dementias and not just dementia, because with the term dementias, we refer to different clinical pictures that all share some common elements. They all, unfortunately, have a chronic course, they all have an organic basis, and they are related to age, but they don't only affect older people. Because with the term dementias, we refer to different clinical pictures that all share some common elements. They all, unfortunately, have a chronic course, they all have an organic basis, and they are related to age, but they don't only affect older people. We can distinguish three types of dementias. We have neurodegenerative dementias. That is, those dementias in which the impairment, the atrophy, tau of neurons, is due to a disruption of biochemical processes in the brain. And an example of this is Alzheimer's disease. We have vascular dementias, where this impairment is caused by a disruption in blood circulation. And in this case, we also talk about very infarct-related dementias. Finally, we have secondary dementias. That is, those dementias where the damage is due to a previous condition or illness, which can be, for example, Parkinson's disease or even alcoholism. Why do we hear more often about Alzheimer's disease? Well, maybe because Alzheimer's disease is the most well-known form of dementia. As of today, unfortunately, there are no cures for Alzheimer's or for other forms of dementia. Early diagnosis and support improve life quality for patients and caregivers, and a good support network around our loved one, they can to some extent lead to an improvement in the lifestyle, not just for the person who is ill, but also for those who take care of them.